probably accidental. Or if we see bruises where we don't expect to see them, say the back or the torso, which is like the front of the chest or the stomach, our first thought is that there's something medical going on. Does this kid have a bleeding problem? Is that why he's getting bruises? And we always look at that first. And once we see that there's some kind of incongruity, something is not quite right with the story we're hearing from the parents or the guardians and what we're seeing as trained physicians, then we start to ask those questions. And we don't run to report. We first ask our own questions to see what's going on, what's happening. Right. And so we can tell from the physical examination and from the history that we're getting from the parents. And once we put that all together, we get a very good picture of what's going on in that household. Right. And many times parents think that they can either fool us, or maybe they're afraid and they think, well, this kid has a burn and the parents are going to be accused. But we can pretty much tell if the story is going with what's actually happening.
Exactly.
Yeah.
Well, during our training, you know, we're taught to look for certain signs and symptoms.
Exactly.
During my residency, when I worked in the pediatric aspect of the ER, that's when I would encounter intentional versus accidental, and that's when you really are exposed and you really have to learn and understand the difference. Different parts of the body, like you said, if it's defensive wounds, you know, if the patient was blocking or something like that, and you're seeing in certain parts, versus on the knees where they scuff themselves, or on the palms of the hand like they were trying to, you know, protect themselves from a fall. So, and also there's other areas like burns and so forth, like from hot water in certain parts of the body.
Absolutely.
That we look for. There are signs and symptoms. And then, like you said, we look at the history, we take a clinical snapshot and try to piece it together, and that's where we are called detectives, not just physicians.
That's
we
correct.
detect.
That's correct.
Now, once a patient comes in and you see injuries, you're not sure if it's accidental or if it's intentional. How can we help? What's the next step? How do we help?
Okay. Well, that's actually a very good question, Elby, because what we want to do is help. That we're not here to make life difficult for any parents or life difficult for a child. Instead, we're here to save lives. And we as pediatricians and family practitioners are dedicated to saving the lives of children and adults. And so what we want to do is make life better for you. So when you come in to see us and we see that there may be something wrong, the first thing we do is offer whatever resources we have. And of course, our resources come in making sure that the child is healthy, providing the medication that they need, doing their physical examinations, and then providing the guidance and providing answers to questions that you may have as a parent as to how we can help you to raise your child in a healthy way. So a lot of our training will be on what we teach in the office, how to eat right, how to keep your child safe, how to make sure that to teach a child the right way, to make sure the child knows how to protect himself or herself, and to make sure that they have open lines of communication with the parents. And that's key, because if your child is afraid to talk to you, then he will not talk to you, and that's when bad things can happen more easily.
So you're focusing on the educational component and then the communication.
Yes.
And that's vital to, like every show, we talk about relationships. That is the key to all relationships. Education and communication.
That's right.
Solid foundation.
Yes, and that's important. It's important to have that foundation, and that foundation comes with the interaction that you have with your children and with each other as parents, whether you're together or not, because you could have parents who are no longer together, but you are still a parent and you're still responsible for that child. And so we can pretty much tell good parents as opposed to parents that are having difficulty, and we can pretty much tell who needs more help. And one of the important things that I'd like to bring out to the community is to remember that physicians are there to help, providers are there to give you whatever it is you need to be able to give you the strength that you need to be able to raise your children in a proper and safe way.
That's important. Again, that educational component, you focus on the tools and the resources.
Right.
That is what we're here for. We want to provide tools, a mechanism, and the education.
Exactly.
You could have all the best intentions in the world, but if you don't have the proper tools, and that's the knowledge, the education, and you don't bring this to the attention of the provider, Dr. V and myself, you're not going to get the proper education and get the proper medical attention if necessary, or social services, because sometimes it has nothing to do with medicine, it has to do with the social environment, the living environment, and we can help provide or at least give guidance.
Exactly.
I'm not a social worker, but I am, but not, you know, at the, to the degree of a social worker where, like in a hospital, where they can make the calls with welfare and so forth. Well, I would give the guidance, say you need to speak with this individual.
Right.
So I offer the knowledge,
Right.
the knowledge of this is where you need to go.
Exactly, because you have that kind of expertise. So when a parent comes to you and you know that parent is out of a job for some reasons, trying to raise a family and provide for that services, and they're short-tempered because of what's going on, and a kid gets hit inappropriately, that's not a case that we're going to report to ACS. We know what's going on, and we understand, and we try to provide them the resources. We might refer that parent to a place where he can get a job, or refer them to a place where they can get the therapy so that they can be able to deal with the kinds of problems that we have here in the Bronx.
Right. We also offer the coping mechanism.
Exactly.
A lot of times, like I said, even with adults, but if it's children having children, they don't have the maturity yet, and so their threshold, their tolerance level is extremely low, you know, especially if they have a newborn. You know, the newborns, the voice is extremely high-pitched, and it becomes very irritating, you become very frustrated, and you snap a lot sooner than someone who's trained. So we have to educate with the coping mechanism.
Yes, having children is a special case, because they really don't, they've never gone through adolescence, they've become parents, and all of a sudden now you're responsible for another human being, and that's a great responsibility. And actually, you know, I don't think I've ever told you, I've actually taken kids home with me. I had, for instance, a teenager who had a child who had pneumonia. She had a clinical pneumonia. She had that she needed, it didn't need to be admitted to the hospital, but certainly needed to have medication 4 times a day. And the child always crying and screaming, and as you say, they just don't have the tolerance for it. And one day she came to my office and said, I get so angry, I just want to toss that baby out the window. And all the red flags went up, and I said to her, because she was my patient prior to being a mom, and I knew her mother and her family, I said, you know what, why don't you let me keep the baby for a couple of days and give you a break? And I took that baby home with her permission and the grandmother's permission. 3 or 4 days, she was able to settle down, calm down, work out some of the difficulties going on in her life with the baby's father. And she called every day wondering where her baby was, and thank God that worked out really well. I got her through the rough period. By the time she got back, the baby was already feeling better, coughing less. I changed the formula. So I was able to do things that she couldn't do for that baby, and thank God that family's doing well today.
Right.
Yeah.
Now, the next question would be, when and why would you call the ACLS?
Yes, that's key. We're mandated reporters, which means that if we have any suspicion of child abuse, we don't have to prove it. If we so much as suspect that someone is abusing a child, we are mandated to report. So we do report if we see a child with some kind of injury that we say this was intentional injury and we're afraid for that child's life, we report those kids. And many times we will call and say, we think so-and-so got hurt. And what happens is ACS will come up and they'll do an investigation. The investigation is not done by the providers. We don't do that. As OB said, we're not social workers, but we are at the front line. We're seeing that kid undressed. We have the ability to examine that child from head to toe, and we can see if something is going on, and it's our job, and it's my passion to make sure that children are safe. And so one time I was talking to OB about Nitzbury Brown, and we said, well, that child was a 7-year-old weighing in about 35 pounds when she was injured allegedly by her parents. That child did see a lot of providers in her lifetime. She was getting WIC when she was up to 5 years old. She was in school. She had neighbors. She had parents. She had friends. She had relatives. She had people around her all the time, and yet no one came forward, with the exception possibly of the school that pushed really well, the school social workers and teachers, to get ACS involved in that family. But it should have taken everybody, all of us, anyone. If you see a child, a neighbor, a relative, and you say, well, that kid really looks underweight, or that kid just doesn't look right to me, or you see something, act on it. You're not required to prove that anything's going on. All you have to do is make one simple phone call, and we'll give you